All right. Well, here, let me, I guess I tried to get through some of the easy stuff, like your CAT scan looks about the same. That's pretty good news. I'm getting less and less concerned about cancer in particular. Fungal culture from your mucus is nothing. I guess that bug candida does not actually cause infections in the lungs, and so it probably was just a contamination or something like that. There's nothing we need to do about that. But then the other result that we have from your mucus, I think, is really, I don't know, I'd look at it as kind of good news and maybe a good explanation about what might be going on in your lungs. You grew a bacteria out of your lungs called Pseudomonas.
How do you spell that?
Yeah, Pseudomonas. Pseudomonas. Yeah, and that's kind of like a special bug. It's kind of like a bad bug that causes pneumonia. Yeah, and so, really, I think it kind of makes sense now with this result and all the stuff that we've been seeing on your scans, which is that, I think that this may be like a smoldering pneumonia with this Pseudomonas bug that's been in there for a long time. And, well, I guess I think it's helpful. I think this kind of answers a lot of our questions. This means that I really don't think it's cancer that's in your lungs.
All right.
You're right. I know. I think that I know we've been through a lot of hoops on that question. Yeah, there's still no guarantees. There never are. But I think what we're seeing here all makes sense. Like the biopsy result,
yes.
It says necrotizing granulomatous inflammation.
That's what I read.
Yeah, and so what does that mean? Well, I guess that it's inflammation that's killing your lungs. It's eating your lungs.
Yes.
Necrotizing means that it's dead tissue, and
yes.
Granulomatous inflammation is really a very common type of inflammation caused by infection.
But it's a slow process at this time.
It is.
Okay.
It is. And, well, I guess the way that you feel about, like the way that you're feeling is also part of this, part of this equation. Like if you were really sick, if you were having fevers all the time, if you felt like you had bad pneumonia, this conversation would be a little bit different. I don't think that's how you feel, right?
No, I have, let me express this real quick. Sometimes I have to hold on to the counter, right? To just brace myself up. Or, more bracketing than anything. If I'm standing. Some days I don't have the footing that
Yeah, I hear you. So
would be normal. But there are days that, like right now, I'm feeling a lot better than what I was yesterday.
Okay.
And I find myself sleeping a lot as well.
Yeah. Well, that's kind of I think I'm hearing, weakness, tired, weight loss. And that's more like smoldering pneumonia. That's more like not an acute pneumonia, but a chronic one. And this might be part of like why you feel this way. It's hard to say, it's hard to say how much, it's how much of this is COPD, how much of this is smoldering pneumonia. But I guess we're gonna try and find out.
All right.
You
are my doctor. Go ahead.
Well, and well, this Pseudomonas bug, it tells us like what antibiotics should work for it. It's like a hard bug to kill, and only certain antibiotics work. And really, I guess our best option is probably this pill that's called Levaquin or levofloxacin.
Can
Have you ever heard?
that for me?
Yeah, yeah. And so let me just pull it up real quick, and then
And I'll tell you what,
so
because the bug of the tuberculosis is still dormant. You see.
well, we didn't get any of that. Yeah, so I didn't. We checked you good for TB again, and it's all negative. And so I think it's not that, and instead it's this.
Pseudomonas bug.
Yeah. Yeah, and so the antibiotic that I want to put you on is called levofloxacin. Yep, Levofloxacin.
Levofloxacin. Okay.
You got it. And really, this is like our only option that comes in pill form. And so there's other options to kill this bug, but they're like IV antibiotics. And so fortunately,
in the hospital, right?
Right, yeah. And so fortunately, you don't have to be in a hospital. You don't have to get an IV or anything like that. We can give you this pill, but it is, this is kind of like strong antibiotic.
So it's a very expensive pill. Yeah.
Oh no, I don't think it would be. Are you looking it up? Because usually this is pretty common medicine that I think is probably not expensive. We use medicines like this frequently for like urinary infections, kidney infections, that kind of thing. Any pharmacy would have this antibiotic. It's pretty strong. And well, I'm talking about putting you on it, and I'm talking about putting you on it for a while. I've been saying how I don't think what you have is like an acute pneumonia. Like an acute pneumonia would be 5 to 7 days of antibiotics.
Okay.
I think this is like a chronic pneumonia, necrotizing pneumonia. And for that, I'll often treat for 4 to 6 weeks.
4 to 6 weeks. Okay.
Yeah. And so I was going to send you this antibiotic, basically, a 6-week supply. And
okay.
Yeah, and then I guess this antibiotic can cause problems. Like in particular,
what are the side
yeah, and so I guess there's kind of two that I would mention, which is it can damage the kidneys.
Uh-oh.
I don't really have any concern about that for you. Your kidneys are normal. Your kidney function has been normal every time we've checked. And so it might be something that I might check again, but I don't think I need to hesitate for that reason. The other thing is really, I guess it's really more for your side of things, which is like this can cause things like tendinopathy, like muscle and tendon pain. And
it can cause what?
Yeah, tendinopathy. Tendon.
Okay.
The tendon, Achilles tendon, that kind of thing.
Tendinopathy.
Yeah, tendinopathy. Yep. And that kind of stuff can happen. Really, most of the time, it doesn't. Again, this is like an antibiotic that we prescribe all the time. But, yeah, it is strong, and we're going to be putting you on it for a good long time, and it's basically our only option.
I've got a question on that then. So could it debilitate?
Yeah.
Could it be a permanent debilitating substance?
Yeah. Yep. Sure. Yeah. Like it could be like you could tear your Achilles tendon, and that could be permanent. It could permanently damage your kidneys. I don't think any of that's going to happen, and I think that the benefits outweigh these risks. But yeah, this is what we're talking about. Like, this is not risk-free. And this is pretty strong medicine. Yeah.
I'm glad you're telling me this, because you're telling me I can injure my tendon or other areas where muscle tissue is, right?
Yep.
And it would be permanent, correct?
Yeah. Well, I mean, yeah. If you went through something like that, I think that it's like you have to get surgery to repair that, or You might have to live with it forever. And yeah, those things are rare.
Wow.
But if it happened, and you'd be stuck with it basically forever. Yeah.
Now you're saying 4 to 6 weeks with this potent pill.
Yeah.
Is it a one-a-day pill or?
It's once a day.
Okay. And how many milligrams is that?
I'm going to send you 500 milligrams, which is the medium dose.
Wow.
Yeah. And, well, I guess none of this has to be set in stone. You know, it's all kind of a balance. And this is why we're talking about all of it. You know, from a medical standpoint, I would still say you're not doing well. You know, you're losing weight. That concerns me. You know, that could seriously shorten your life. If I put you on this pill and it's a smoldering infection that's causing you to lose weight, you could end up gaining weight afterwards. You know, it could be easier for you to...
They're going to call me Fatso, finally?
I hope so. Yeah. And
okay.
No, I know this is you that's doing this, and so you're allowed to kind of weigh these decisions because, yeah, you know, today you feel okay. You know, this medicine, while the risk is low, you know, there is a risk of it making you feel worse. Right. All of this is there is a little bit of, you know, an educated guess with what's going on here.
So I'm going to be experimental.
Well, you know, I think that I'm going to send you this medicine, and really part of why I'm telling you all this stuff is because, like, if you don't like it, if you feel like something is going wrong, well, then we're just going to stop it.
Yes.
You know, and yeah, I think that we all have to understand that there's, you know, risks and benefits and all that kind of stuff. You know, this is what we've been talking about for a long time. You have this thing in the top of your right lung, and I want it to get better. And what is it? Well, I don't think it's cancer. I think it might be this smoldering infection. It's all kind of unknown. You know, is this going to get better? I think so, but I don't know. There's a thing out there that's called colonization, where your lung could be colonized with this bug.
I'm a colonized individual, so I understand.
Well, right. I guess colonization means that this bug is in your lungs, but it's not causing an infection. And, like, that can happen. You know, it could just be living there and not causing problems. This is a bug that is known to cause pneumonia. You've got a scan that looks like pneumonia. You've got a biopsy that looks like pneumonia.
Yes. And
so I want you to hear kind of all sides of this, and, you know, we'll figure it out.
Okay.
What do you think?
Well, it's damned if I do and damned if I don't is what I'm listening to.
Yeah, kind of.
And
yeah.
Of course, I'm on the teeter-totter of the possibilities and outcomes having a negative impact of permanence.
Yeah.
And so there is no two ways about it. The dosages I have to take at that dosage for it to be effective on what could possibly be turned into, what do you call it? Dominus bug, yes.
Yeah. Right. No, I think you're getting it. You're reading it back to me, and right. I guess I would rather do this, and I guess kind of see what happens, you know. And I think it's okay to do that, but there's risk in every direction. You know, if we don't.
I'm glad you're being honest with me about the outcomes.
Well, if we don't do it, you know.
Yes.
Well, what happens? Right. What happens if we don't do it? If we don't do it, I guess all I really expect is more of the same. You know, more of the same of what you've been going through for the past months that we've been talking, which is just good days and bad days. The weight loss in particular is like a big concern to me.
I think I saw it in the cartoon. Agony,
yeah.
agony, agony.
Well, yeah, and right. You're in agony. You're not feeling well. This could make you feel better. This could make it easier for you to gain weight. If your body's continuing to fight this infection all day, every day, it's really hard to gain weight when something like that is going on.
So that's what it really is. The determination is that what is this bug that I possibly have?
Yeah.
Is keeping my weight at a lesser amount than what it should be, where I should be.
It definitely could be. And I see these smoldering pneumonias do this to people a lot. Yeah, I think that really only time will tell. But it very well could be that this is why it's been so hard for you to gain weight. And if you lose weight, if you keep losing weight, your life is going to be significantly shorter. And yeah, this is why, look, I don't like doing it either. I'm not going to do it unless I have to.
Yeah.
I think we have to,
Well, I'm looking at it too, the possibilities. And they are, try it for a while and let's see what goes on.
Yep.
On the measures that you dose out that I do daily.
Correct.
And then keep out what I could do, if you wouldn't mind, is I could do messaging to you and let you know what the
that would be great.
Are. We can grow together on this outcome, and if there's any drawbacks or whatever.
No, I know that was going to be kind of my last part of our talk today. Was
be quiet. Go ahead.
Oh no, you're right on top of it. Which is, I'm going to send you. I'll try and answer all your questions right now. So it's I'm going to send you basically 6 weeks of this antibiotic.
Okay.
I want you to take it. I really want you to try and get through it for at least a week. If you're taking it for a week and everything seems to be going fine, keep going. But yeah, reach out to me. You're feeling one way, you're feeling another. Ask me about it. I'll try and walk you through it.
Okay.
And I would go on a week by week basis. I want you to take this for at least a week. If you can get through 2 weeks, good. If you can get through 3 weeks, good. If you have to stop it, try and get through as many weeks as you can.
I would do a weekly report. That's what I'll do.
Yeah, perfect. Yep, and I'll just try and guide you through it. And yeah, we're going to have to talk about it all again.
Okay.
And I'm telling you all the stuff to pay attention to. Muscle pain and aches. How's your weight doing? Do you feel better? Are you breathing easier? Is it clearing up your mucus? I'm going to ask you all that stuff.
I want to do a what was Gene Kelly move? I want to sing in the rain. While I dance.
I guess I'll cross my fingers for you, but I don't know. But all right. So, well then, there's still a couple other things I want to do.
Okay.
Which is, I don't want to be having to do CT scans on your lungs all over and over and over again.
That was going to be one of my questions about radiation. Go ahead.
Yeah, right. It really does. We really do start to run into these questions about radiation if you're doing a scan every couple months.
Yes.
And well, I don't think you've been through too much yet, but yeah, I guess the way that I would do this would maybe just be with an X-ray.
Okay.
Where I do.
X-ray does not give you the intensity.
Correct.
Of a CT or PET scan.
Yep. Yeah. It's like 1/1000th of a CT, and so I think it still might give us the information that I'm looking for. Is pneumonia in the top of your right lung? Is that starting to clear up?
Okay.
That's what I'm going to be looking to see. And yeah, I know it's hard for you to get labs and stuff sometimes, but I am also going to want to check your kidney function again.
I need you to. I'm glad you brought that up. Yes.
Yeah. And so that one, I want you to do that in the next couple of weeks, like a week or two. Like you can start this.
If you would put that on my chart.
Yeah, I will.
We can designate a day so that I can call transportation. I can give them 72-hour notification. I like to do that well in advance. So.
Yeah. I'll order it for, I guess, so today's Monday. I was thinking about like maybe 10 days from now.
Okay.
And so I'll order it for maybe 10 days from now, I guess 2 Wednesdays, something like that. You can start the medicine, but I do want to make sure it's not causing any trouble while you're taking it. And so, I think that...
Through text, I'll talk to, is her name Amanda or somebody I've been talking to?
Yep. I'll be keeping Amanda posted as well because, it's going to be a kidney function test in, I guess, a week and a half, and then a X-ray in like 6 weeks.
Okay.
And then, I guess then the very last question is, when do we talk again? And, should we just talk again in 6 weeks after your X-ray? We could wait we could wait longer if you want.
No, these things are on the expeditious level for me now.
Yeah, I agree. We're kind of doing something here. And so, I'd say, kidney function in a week and a half, X-ray in 6 weeks. We set up another one of these either video or telephone visits right after your X-ray.
Okay.
I think that's the whole plan.
Okay. In other words, I'll be taking these pills.
Yep.
And in a week and a half, am I going to do that function? I'm going to do the kidney function, right?
Yep.
And then 6 weeks from there, the X-ray.
Correct.
Okay.
Yep. When you're about done, if you're able to take the full 6 weeks, at the end is when I want to check the X-ray again. And so, let's see where this takes us. And I guess you should take this pill in the morning. You should take it with food. Otherwise, really, I don't expect it to cause trouble. I expect it to actually help you feel better. Yeah.
Now,
well, and then, go ahead. What do you have? Yeah.
I'm glad I've been fighting wheelchairs and walkers. I've just been standing alone. And
you're right.
Maintain my independence as long as I can.
You're right. I think that, you're seeing kind of some of the same stuff that I'm seeing here, which is good news. Yeah. I don't think this is cancer. I think it is an infection. If it's an infection, that's something that can improve.
That's treatable.
And so, COPD is still going to be there. All that other stuff is still out there. But this, looks like it's fixable. And so, I think that let's see how it goes. Reach out to me anytime via, my chart or call up Amanda and I'll get back to you. I'll get back to you if your kidneys are looking bad or anything like that. We'll be talking again in about 6 weeks. And any other questions, thoughts, concerns about all this?
Well, I have a statement to make, and that is that as I gain weight, more women will look at me, but I have to have my hands-off approach.
Yep.
So, because I don't want to croak like that, brother.
You got to play the long game, but you're right. Some things are always important, and I hear that. And so,
Hey, you look good, but don't touch. Don't just
Yeah. All right.
You pretty much answered everything I needed to have answered. And based on my research in terms of what outcomes could be with what, I can see that this issue is treatable. So.
Yep. And so, really, what we're doing here is actually this is by the book. This is not an experiment. This is what we're supposed to do with this problem. And so let's do it. And we'll talk about it all again soon. And so I'm going to...
I did see Frankenstein. Yes, I did look at Dr. Jack. Yes, I did all of that. So
I'm gonna order all that stuff that we talked about. The medicine should be at your pharmacy soon. Labs in 10 days. X-ray in 6 weeks. And talk to you soon.
Hey, love you, man. I'm gonna tell you that, doctor.
Yep, that's nice. I feel the same way. You know, I enjoy talking with you. I really hope we're talking next time and you're noticing you're doing better.
Yes.
All right?
My voice has got to get better. My voice.
Yeah. Yeah.
All right, brother.
Well, we'll set it all up. I'll talk to you soon, okay?
Thank you, Doc. All right.
Bye now.
Bye-bye.